We're talking about epicystostomy. For this procedure, we'll be using two different types of catheter. First type will be the pigtail catheter or JY catheter, and second type will be the Foley's catheter. So before we begin, let me familiarize you with the equipments we have. First, we have the trocar with the needle with the trocar, which I'll show you here. The needle with the trocar. The Foley's catheter, which we have here. Here, this is the end for injecting fluid, and this is the end where the balloon, this balloon will flare up. Here we have the pigtail catheter. It's small, but actual pigtail catheter looks like this. And here we have the needle. The needle is actually longer, like this. One side we can see the pigtail catheter. And then we have the anesthetic solution, lidocaine and scalpel. And then here we have the wire which we'll be using in inserting pigtail catheter. Okay, so before we begin the procedure, we should understand that all aseptic and antiseptic techniques must be practiced well. We should see if there's any contraindication for the patient. The procedure must be done in a sterile environment. Staff should be wearing sterile gloves and apron. So before we begin the actual procedure, we must ask the patient to drink water. This is to raise the level of the bladder above the symphysis pubis. If in usual cases, due to urinary retention, the patient will present to us in this state. But in case if we are going to insert suprapubic catheter, we must ask the patient to drink water, which is a physiological method, or manually we may try to inject the fluid through suprapubic injections into the bladder. So the patient will be lying in supine position. Initially, we must determine the point of puncture. This is going to be 2 centimeters above symphysis pubis, which is 2 finger breadths upwards. So, which will be here. So, in order to make sure that the bladder is above the symphysis pubis level, we'll perform palpation to see the level of bladder. We'll confirm it, or we may even use ultrasound if it's at our disposal. After we confirm this, we'll start to clean the area. The area must be shaved, and we'll use antiseptic solution, which will be alcohol or iodine. We'll start from the center where we are going to perform the puncture, and then we'll move in outwards direction in a circular motion. And we'll do it twice using different cotton wools. After this procedure, we may mark the point of puncture with cotton ball dipped in iodine. After that, this procedure, we are going to inject anesthetic solution, which is lidocaine. Here we have lidocaine, so we fix it, and then we insert at a 45-degree angle. We inject subcutaneously. We want a wide area of coverage. And then also intramuscularly. Give time for the anesthetic to take action. Will be around 2 to 3 minutes. Meanwhile, take the scalpel. The scalpel should be held in pen position, like so. And then we are going to make a superficial incision on the skin. This is just to break the skin, so that the needle goes into the skin smoothly without any disruptions. So the incision is made in such manner. Stab, 45-degree stab, 45-degree, and then there will be bleeding. Bleeding is arrested by gauzes. After the bleeding stops, we'll take the needle. The actual needle is long, as I mentioned before. And then the needle is directed at a 90-degree angle to the skin in such manner. when the needle is in the bladder, the urine will start pouring out. At this point, we will stop the flow of urine to prevent rapid decompression of the bladder, and then we will insert the guide wire. The guide wire will help us thread the tube later. So actual wire is straight, this wire is a bit bendy. There we go. So here we are sending the guide wire. We can be generous with the amount of wire because the bladder is already distended. Once it's in the bladder, we can retrieve the needle. We can withdraw the needle. Now, since the guide wire is in the bladder, we can now use a tissue dilator. It will be this. We'll be using the tissue dilator to reduce the strength, the tension around the tissue, which will help us to insert the catheter later. So this is our tissue dilator. The tissue dilator is advanced in such way. The bladder, once it has been dilated, we may withdraw it, and then we can begin threading the tube. So this is our tube. So the actual procedure is faster since our tube is, the wire is a bit bendy. It's taking our time. So then we guide the pigtail tube into the bladder. Once it's inside, we can see the flash of urine. At this point, once it's inside the lumen of the bladder, it will start coiling. So it will lock the tube and it will prevent it from coming out back. So then we withdraw the guide wire. Now this setup can be attached to a urine bag, and which will be placed on the thigh of the patient. We should keep in mind that we should prevent rapid decompression of the bladder. So initially we may apply a clamp and slowly release the urine till the patient feels comfortable. So next procedure, we'll be using a Foley's catheter. So in a Foley's catheter, the procedure until we break open the skin, it's almost the same, but the procedure differs because we'll be using a trocar to widen the incision, and trocar with the needle will be used to widen the incision, and then the catheter is obviously different. So initially, after we break open the skin, we'll be using the trocar with the needle, and then we'll go at a 90-degree direction in a rotating motion like so. Once to check if the trocar with the needle, trocar is inside the urinary bladder, we can slightly withdraw the needle and see the urine pouring out. Once it's in the bladder, we can withdraw the needle and close this aperture with our fingertip, and then we may start advancing the Foley's catheter, which is here. Like I mentioned before, there is a balloon here which we will flare when we confirm that it will inflate when we confirm that the catheter is inside the bladder. So here, let's start advancing. Once we see the flash of urine, we'll stop, and then we can, through this aperture, we'll be injecting a liquid which will come with the catheterization kit. This will go and inflate the balloon like we saw here. This balloon will be inflated, and it will hold on the catheter safely. In actual scenario, this catheter, this trocar can be removed sideways, so we can easily withdraw them from the tissue, and then once it's outside, we can break it sideways, and then it can be removed like this. So that is the method of catheter insertion using 4D. Thank you very much.